Now to Professor Derya Unutmaz, who's an immunologist with Jackson Laboratory and also a researcher on infectious diseases, and he joins us live from Farmington City in Connecticut. Welcome to the program. Great to see you. Just tell us, how fair do you think the criticism is of the CDC when each state in America is responsible for its own COVID policy?
I think at the very beginning, there was a lot of confusion, and CDC definitely did some missteps and some mistakes that were not very good. But you have to also understand that this was a completely new virus, and there were a lot of issues at the time, and they did correct a lot of these things. I think right now it could be a little bit unfair, but 2 years ago it was definitely fair to criticize some of the steps that they took. They definitely can do better, but unfortunately some politics were involved. And as you pointed out, in the US, states have a lot of independence for their own rules and regulations.
And just for precision, what do you think could have been done better to avoid what is now the highest number of COVID-related deaths in the world? This is so sad.
Yes, it's really very sad, and especially in the last year or so, most of these deaths could have been avoided because of vaccines are so effective. I would say 95 to 99% of these deaths were totally unnecessary. They could have been avoided even if there were not major restrictions. I think the major problem have been, and this is not just the U.S. Throughout the world, is really communicating to the people what was going on. There was a lot of mixed messages and a lack of transparency. This includes the U.S. as well. Really explaining the effectiveness of vaccines, the side effects, and a lot of worries that people had about the vaccines. So I think these could have been much more effective, and also maybe more importantly, to fight with the misinformation. There was so much misinformation about both the pandemic as well as the vaccines. A lot of people didn't believed in those things instead of believing the government or CDC and other such organizations. WHO is the same situation. At the beginning, they did a lot of things either too late or they were not very open about it. And so these resulted in loss of confidence in these organizations. I think they need to be very straight with the public and explain things in a very clear manner.
And I know obviously you are in the US, but when you look at the rest of the world, surely now this self-examination of the authorities responsible for health needs to happen in other countries now that we are slowly, hopefully, coming out of the pandemic, to avoid another deadly strain or also another pandemic.
Yes, I completely agree, and I think some of these lessons have not been taken by some countries, and this actually includes China. As you know, they've shut down a whole city of Shanghai. They're still insisting on this zero COVID policy, which is not sustainable, and I think they're not being honest with their public either. I would hope that for the next wave, or which I think won't happen, but maybe for the next pandemic, we can be more open and more transparent to the public.
Derya Unutmaz, Professor Derya Unutmaz, thank you so much. Always a pleasure to speak to you here on TRT World. Take care.
My pleasure.